And good morning and welcome back. I'm Mabel Jong and you're watching the last day of coverage here at the World Healthcare Congress in Washington, D.C. In our studio this morning, we have Linda Rosenberg, who is President and CEO of the National Council for Behavioral Health. Good morning, Linda.
Good morning.
Well, it sounds like you had a fantastic session just now. We'll talk a little bit more about what went on there. But I am getting the sense that we sure know a lot about how behavioral health really should be integrated into the primary care setting. People should be asked about this and then it should be addressed. But we're not seeing it that often. Why is that? Is there a stigma perhaps surrounding this?
I don't think it's a stigma. I know a lot of people do. This isn't necessarily a popular response you're going to get from me. I think it's new. I think, mental health and addictions always lag behind general health care. And that may have been stigma really early on, but the continuation of it is really about changing practice. And the models that have research and we know work don't necessarily translate well to the individual general practitioner or internist who operates alone. They're really team-based, they're collaborative models, and yet practice doesn't exist that way, although I think it's coming. So I think we have big ideas, which is the right thing, but then we're going to be making incremental progress. And I think that's where we are. I think the other piece of that is how is payment aligned to get the results we want. And again, we're not quite there yet.
Okay. Well, your colleagues earlier did say that there are a couple of things also going on, that there's a shortage of mental health professionals, and also asking perhaps the primary care physicians to take this on as well could be an answer. What do you think?
So I think there is a shortage. I would argue there's a shortage of primary care physicians as well, and even nurse practitioners. So we're an association of about 2,700 organizations that provide mental health, addiction, and some general health care. And I think if you asked any of the CEOs of those organizations, they would in the top 3 talk about workforce. And I am just concerned that healthcare has been been portrayed so negatively in so many ways, as difficult, as not as good as it should be, that it may be that among young people, it's not as attractive to become a healthcare provider as it was at one time. So, I have a staff of young policy people, and sometimes I think they're the best and the brightest. 20 years ago, they may have become healthcare providers in some way. So I think we have that issue, that it is seen as not very attractive. Salaries have lagged, and we have catching up to do around psychiatry, because many psychiatrists don't take any insurance at all. And so how will that change as psychiatrists become employees of bigger organizations, which then can also deliver more collaborative and team-based care? So I think we're just seeing evolution.
What do you think ideally should happen? Both on, or your wish list, if you will. What do you think would provide more care in the primary care setting, and who should pay for it, and how should be paid for it? Have any thoughts on that?
Yeah, so I think the care in primary care needs to be available 24/7, which is why urgent care centers are so popular. I tried to get a hold of my own internist. Well, she's there 3 half days a week. So I'm going to go to an urgent care center of some kind. Many of them are becoming connected to bigger hospital systems, which mean you can get all the aspects of your care under one auspice, which ultimately will get one payment for your care as an individual, whether it's through a commercial insurer, Medicare or Medicaid. I think that's the direction. Some people call it value-based payment. And I think when you go to that primary care center, which is available to you whenever you need it, there is a team there There'll be a behavioral health person. There'll be a screening that they do each time you come, just like they take your blood pressure. They'll do a quick mental status. We're also, mental health and addictions don't use standardized instruments the way we will, I think, in the future. They'll have a psychiatrist, maybe through telemedicine, so that they'll be hooked in, and that psychiatrist may be in Iowa and I'm in New York, and they'll do a quick assessment. They'll help the primary care doc or the nurse practitioner, the behavioral health specialist, direct my treatment, and they'll continue to work with me. If I need to be hospitalized, it'll be part of that network.
Okay.
If I have a comorbid physical condition, my endocrinologist will be part of that network. That would be the world, I think, that the ACA intended, and that it will take us some time to get there, but I think that's the vision.
Okay, and to get to that, to make that vision a reality, do you think there needs to be federally mandated programs?
Well, you know, we have this tension in our country between anything federally mandated and states' rights. I think we're seeing that played out in some ways in the presidential election and the discussion there. Many people in healthcare have a more progressive view, in that I personally think federal mandates, or at least a federal floor, is a very good thing. One of the things the National Council's been very involved in is something called the Excellence in Mental Health Act, which was passed, and now there is a bill to expand it, which would create these centers in communities around the country that would have some federal mandates. So you'd have some standardized care from place to place.
Okay. Any other takeaways, Linda, you believe people ought to have before they leave this meeting?
I think the takeaway is this is a very good time for mental health and even for addictions, not for the people suffering. We still have a lot of work to do, but certainly for the conversations that are going on, conversations that wouldn't have happened even 10 or 15 years ago. I think that's an optimistic kind of point of view. I think the public is amazingly interested in these topics. We do something, we brought to this country mental health first aid. We've trained over 500,000 Americans to date in being more literate about mental illnesses and addictions and what people can do to help each other. You know, not everything requires professional intervention. So I think that's another message, is people really who understand what to do in an emergency can be helpful to their colleagues, friends, and relatives.
A very valuable reminder. And finally, we love seeing you at this meeting, Linda. What keeps you coming back?
I think I think one of the things we all have to be committed to, no matter what field we're in, but particularly in healthcare, is being an avid learner. So that throughout our careers, we are learning new things. This is a meeting where I learn a lot of new things, and that's very important to me, and I hope influences the kind of work that I do every day.
Linda Rosenberg, thank you so much.
Thank you.
And I'm Mabel Jung. Thank you for watching.